morning. My name is Connor Shepard, and I'm here at WellSpan's Cardiac Rehab. I am presenting my education project. Unfortunately, due to HIPAA laws, I am not able to film myself presenting to the actual patients. However, I have here my handout that I have made for the patients to teach them about some common cardiac rehab medications. I'm just going to act like I am presenting to a patient. So, good morning. I'm glad you are interested in learning more about your medications. I have created this packet for you. My goal for this session is for you to improve your knowledge about the medications you're taking for your heart. And my objectives are that by the end of this session, you can name 2 of your medications and 2 of the reasons why you are taking them. My second objective is for those 2 medications, you should be able to also list 2 potential side effects of that medication. So here on pages 2 to 4 of this handout, I'm just going to cover some basic information on medications in general. So, why are you taking these medications? One of the reasons you would take these medications is to prevent another life-threat event, such as a heart attack. These medications will also help you improve and or maintain your quality of life and help you reduce your risk of hospitalization. These medications, if taken correctly, may also help to prolong your life. You might have a common question, what do I do if I don't take my medication? Or what would happen if I don't take my medications? Well, if you skip your medications, the symptoms it may cause worsening of the symptoms that you are feeling. It may interfere with your abilities to perform normal activities, and it may cause a rapid decline in your health. So it's very important to take these medications regularly and to stay compliant. A lot of people have issues with remembering to take the medication, so there's many ways that you can remember to take them. One way is it's very important to keep an up-to-date medication list. You should also have a habit. So you should start taking your medications at the same time every day so you get into that routine of taking them. You can also associate taking your medication with a daily routine you already do, such as brushing your teeth or breakfast. So every time you brush your teeth or every time you sit down to eat breakfast, you take your meds. That way when you remember, when I do this, I take my meds. Pill boxes can also be a very helpful tool. That way you know if you've missed a day, or you can look and you wonder if you took them that day, you look, and if that day is empty, then you know you've taken it. It can be helpful to get all of your medications filled at the same time, so that way you don't run out of medication early. It's also important to call your refills in several days before you actually need them, because it can take a little bit for these medications to get refilled. Another common question is, what do you do if you miss a dose? If you miss a dose, you shouldn't double up on your medications. In other words, don't take your missed dose with your next scheduled dose, because that could cause you be taking too much medicine. If you only missed it by a few hours, you can go ahead and take it as soon as you remember. If you missed your dose by more than a few hours, you should just wait and resume the medication at the next regularly scheduled time. Another common question is, how can I avoid medication errors? So it's important to review all your current medications at each doctor's visit, and this includes supplements as well as prescriptions, because many supplements and over-the-counter medications can actually interfere with other medications or be processed by the same systems in your body and can cause your body to not be able to process other things as well. It's important to repeat new medication instructions back to your provider, so that way you know you understand and your provider knows you understand. You can ask for written instructions on how to take your medication if you're unsure, or if you think you'll forget, and you can use that as reference. You should also use one pharmacy to fill all your medications. And if you have any questions, just do not hesitate to ask your doctor and or your pharmacist. They are trained in these things. They can help you. I'm now going to talk about 4 of your medications you told me you were taking. These medications are aspirin, Plavix, Lopressor, and Crestor. You can follow along with the graphics and the notes I put in the handout I gave to you, and you can stop and ask me questions at any time if you have questions about this. So we'll start with aspirin. So why do you need to take aspirin? Aspirin helps reduce your risk of a first or a recurrent heart attack. It helps, you might need to take this if you have blockages of your heart vessels, if you have a stent placed, or if you have bypass surgery, or if you have atrial fibrillation. How does aspirin work? Aspirin prevents platelets from forming unwanted blood clots. And these blood clots are what can break off and occlude vessels and cause you to have strokes and heart attacks and things like that. The usual dose of aspirin is 81 to 325 milligrams once daily is usually the doses, anywhere in there. Now there's some common side effects with aspirin that you have to look out for. Bleeding complications is the main one. So you should really look for and be aware of any unexplained bruising, bleeding from the gums, bleeding in your urine or stool, and you should immediately report any of those symptoms to your doctor because it could mean you're bleeding on the inside and the aspirin is causing you to bleed too much. Another common side effect of aspirin is stomach and intestinal ulcers. This is more rare and it's likely to occur in those with a history of bleeding stomach ulcers. Now we will talk about Plavix. Why do you need to take Plavix? You may take Plavix if you're unable to take aspirin. It can also help reduce your risk of a first or recurrent heart attack. It can help if you have blockages in your vessels. Plavix is typically prescribed after a stent placement or a bypass surgery. It is usually prescribed for at least 30 days after the stent placement. And that's to help platelet aggregation on these stents and on these bypasses. If you have atrial fibrillation, it is important to be able to take Plavix to help lower your risk of blood clots. And if you're high risk of a stroke, they may also prescribe you Plavix. How does Plavix work? Plavix works much like aspirin as it helps prevent platelets from forming unwanted blood clots. These unwanted blood clots may again cause a heart attack or a stroke. What is the usual dose? The usual dose of Plavix is 75 milligrams once daily. Common side effects of Plavix, again like aspirin, because it helps stop the formation of clots, your risk of bleeding will be increased. So, just like aspirin, you should report any unexplained bruising, bleeding, bleeding from the gums, blood in your urine, blood in your stool. You need to tell your doctor that immediately. Stomach and intestinal ulcers, again, this is more rare, and it is also more likely to occur in those with a history of stomach and intestinal ulcers. Here we go. We are now going to talk about Lopressor. Lopressor, also called metoprolol, is a beta blocker. Why would you need to take Lopressor? Lopressor can help lower your blood pressure. It can help decrease your heart rate. It can help decrease the frequency of chest pain. It can help reduce the risk of first and recurrent heart attacks. And it reduces the risk of hospitalization from congestive heart failure. So how does Lopressor work? Lopressor is a beta blocker. Beta blockers cause the heart to beat more slowly and with less force. So this helps lower your heart rate because it causes it to beat your heart to beat slower, and because it causes your heart to beat with less force, it helps lower your blood pressure. Beta blockers can also help widen the vessels to actually help improve blood flow and help increase perfusion to areas that are needed. The dosing of Lopressor. The usual dose it can vary depending on what you're taking them for. So for high blood pressure, the usual dose is 25 milligrams twice a day, up to 225 milligrams twice a day, anywhere in between there. For heart failure, it can typically be 6.25 milligrams or 12.5 milligrams 2 times a day to 100 milligrams 2 times a day. The maximum dose of low pressure is 225 milligrams 2 times a day. Some common side effects are fluid retention, low blood pressure or dizziness. So what you want to do is space this medication apart from other blood pressure medications to help keep from dropping your blood pressure too low too quickly. And you want to slowly change position from lying down, from when you're lying down to sitting or standing. If you sit up and you feel dizzy, just sit there for a minute. It might take a second. The big fear is that your blood pressure bottoms out too much and you can pass out and fall. Fatigue is another common side effect of low pressure. It may take 2 to 3 months for fatigue to improve after starting this medication. Low heart rate or bradycardia is also a side effect of this medication, as well as wheezing and impotence. It's very important to know that stopping low pressure immediately can be very dangerous, as your blood pressure can return to a higher level than it was before starting this medication. So it's very important to talk to your doctor before starting this and do not just stop taking this medication. The fourth medication I'm talking about is Crestor. So why would you need to take Crestor? So Crestor is a medication that they call a statin. It helps regulate your cholesterol. It helps decrease your LDL cholesterol, which is your lousy cholesterol, and it helps increase your HDL, or your good cholesterol. It can possibly decrease triglyceride levels as well, and this will help reduce your risk of first or recurrent heart attacks. So let's talk about the basics of cholesterol. So you have lipoproteins that carry cholesterol through the body. There's 2 basic types of these lipoproteins. The low density lipoproteins, or LDLs, which are the bad or lousy cholesterol, and you have high density lipoproteins, which is HDL, or the good cholesterol. If you have too much of these LDL, this lousy cholesterol, it can build up to the walls of your it can build up and stick to the walls of your blood vessels. This will narrow your blood vessels and can restrict or block blood flow to your heart and your other organs. When this blood flow is blocked, it can cause heart attacks. When the blood flow to the heart is blocked, it can cause heart attacks. If the blood flow is blocked somewhere else, like the brain, it can cause a stroke. So the HDL is the good cholesterol. And this high-density lipoprotein carries cholesterol back to the liver, where it can be flushed from the body. So high levels of HDL cholesterol can actually lower your risk of heart disease and stroke. So what is the usual dose of Crestor? The usual dose of Crestor is 5 milligrams to 40 milligrams once daily. So common side effects. What are some common side effects of Crestor? The common side effect of Crestor is you have mild muscle aches and pains. This is most commonly noted in the legs. Other common side effects are headaches, stomach aches, nausea and vomiting, and diarrhea or constipation. A very serious side effect is severe total body muscle pain and dark-colored urine. If you have these, you need to immediately get attention from your doctor. Impaired liver function and advanced problems can usually be prevented if you have liver function and cholesterol labs prescribed by your doctor on a regular basis. I have included some references on all of these medications I've given you here today, if you want to do some of the reading on your own. If you have any questions, you can happily ask me or any of the other staff here at Cardiac Rehab, and we will be happy to help you.